For the last 17 years, Benon Kabale has been receiving medication for a mental health condition. He usually obtains his treatment in either Mulago or Butabika Hospital.
I got hospital for review every after 3 months. During the review is when the prescription is done for certain types of medicine that I'm required to take.
However, on his last medical review, Kabale was informed that there was no medicine for his prescription.
And this required me to go out outside and private pharmacies to buy medication. But you find that this medication is very expensive.
According to Derek Chiza, the Executive Director of Mental Health Uganda, the shortage of mental drugs is now coming to a year.
In many health facilities, regional referral hospitals, but also clinics that are run by KCCA here in Kampala. The risk in this is that we are likely to lose more people to mental health conditions than COVID, where government is putting much more attention.
Unfortunately, the mental health advocates are unaware what caused this shortage in drugs.
We don't have a clear explanation yet from the Ministry of Health. What I certainly think is that much of the resources were diverted to treat COVID.
To make matters worse, even referral hospitals that have been catering to patients with mental health conditions were turned into intensive care units for treating COVID-19 under a directive from the Ministry of Health.
In a situation where we don't have mental health clinics in 12 of the 14 regional referral hospitals, so it means that we can't admit patients.
Psychiatrists have explained why it's critical for mental illness patients to access treatment as prescribed by medical practitioners.
Is to reduce the severe symptoms and so that the patients may be amenable to support and counseling.
Dr. Tukuminsiriza explains the implications of patients missing out on their treatment.
They may be severely depressed and they may not really look after themselves. They may not work. Some may attempt suicide. Some may actually waste away and even die of starvation.
In its response, the Health Ministry has explained what may have caused the shortage.
And I think it cuts across all the, there's a general shortage of medicines in the country.
Dr. Lukwata tells us what measures are being taken by the ministry to address this shortage.
We've talked to NMS, we've talked to our leaders within the Ministry of Health to be able to ensure that the mental health medicines are actually do not run out of stock.
Joyce Nakato, NTV Tonight.